Experts remain concerned as monkeypox continues to spread. And with vaccines in short supply, could the virus spiral out of control? I'm Jafar Hasnan, and today's newsmaker is monkeypox. Monkeypox may not be as deadly as COVID-19, but that did not stop the World Health Organization from declaring the recent outbreak a global health emergency.
I have decided that the global monkeypox outbreak represents a public health emergency of international concern.
But if monkeypox does not spread nearly as fast as the coronavirus, and if it is less deadly, why then are scientists still worried? Well, primarily the reason is it is turning up in places it usually does not. In this recent outbreak, there have been around 237 cases and 7 deaths in nations where the virus is endemic. But now, 82 non-endemic nations also have confirmed cases. More than 31,000, in fact. The U.S. has the highest number with almost 11,000. More than 5,000 Spaniards have tested positive and 2 have died as a result. In Germany and the UK, there have been close to 3,000 cases. In Brazil, more than 2,000 people have been infected and 1 person has died. And India and Ecuador have also seen people die because of the virus. Now, one nation which is particularly concerned right now is the United States. As you saw, their numbers have been rising faster than they would like. Demand for vaccinations has been high, but supply has been pretty low. In an attempt to remedy the problem, the U.S. is taking an interesting approach by giving just 20% of a usual dose. But if the United States thought it was suffering from a shortage, spare a thought for Africa. According to the continent's public health agency, they have not got a single dose. That is 1.3 billion people who do not have access to the vaccine.
To date, there are no vaccines that we have received as Africa for monkeypox, though we continue to engage with relevant institutions and our partners across the world to try and get monkeypox vaccines.
And joining me now from Geneva is Dr. Margaret Harris. She's a spokesperson for the World Health Organization. From Pittsburgh is Dr. Amesh Adalja. He's a senior scholar at Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. And in London is Global Health Advisor Oksana Pyzik. She's also a senior teaching fellow at the University College London's School of Pharmacy. Thanks all for being with us today here on The Newsmakers. Dr. Adalja, let me begin with you. Why are we seeing a rise in cases of monkeypox in non-endemic countries?
The rise is due to the fact that the virus found itself in a social sexual network that allowed it to spread wider and faster than it ever had before. And it's not just that it was in this network. It was masquerading as a sexually transmitted infection, getting misdiagnosed probably for several weeks to months before it was actually known that this was monkeypox and not some other infection. And it used amplification events like raves to really be able to disperse throughout the country. And we've been playing catch up in the United States and Europe, trying to get ahead of all of these cases. And we don't really have enough of the tools that are necessary. We've had really fragmented testing. We've had poor access to the vaccine. And that's allowed this virus to get where it has. But it is something that is containable. It is something that's known to science, so it's not anything like what happened with SARS-CoV-2 or COVID.
Okay. Dr. Harris, let me come to you now. Transmission through sexual contact. Is that a new mode of transmission when it comes to monkeypox?
The monkeypox basically is transmitted through close physical contact. And I think we would all understand that all manner of most forms of sexual contact do involve close physical contact. So we describe it as a sexually transmissible disease, but as my colleague on the panel just explained, it's not an STD. It's not a sexually transmitted disease. It's simply that during close physical contact, if you have close physical contact with somebody who has the blisters at the time, you could indeed or are likely to be infected.
But Dr. Harris, let me add one more question here. Now, in one of the speeches that was made by the Director General of the World Health Organization, he specifically spoke about this new modes of transmissions. What was he referring to?
So it's really that we're seeing it transmitting so rapidly and in such large numbers, and we want to understand if there are different ways it's transmitted. So we're seeing that the virus is in two what we call clades in Africa, but almost split down the middle of the continent, one and two. And the clade we're seeing now in the rest of the world is the second one. And there have been some slight divergences. So we're trying to understand, we need to understand, is this having any effect? Unfortunately, we don't have the information at the moment. But what we are very grateful for is the really openness that we've had from many of the people who've been infected, who've been willing to give us a lot of information about what was occurring. So we are getting much more information. And that's why it's absolutely critical that we don't have people attacking and criticizing those populations who've been infected. It's not through any fault of their own. It's happened, and they're helping us, the world, to understand how to shut this down.
Okay, Oksana, is there still a lot that we do not know about monkeypox?
Certainly, we have not seen the virus outside of Western and Central Africa, where it's endemic. So there is still a lot to be learned, particularly around the effectiveness of the vaccines available. We do have an older form of the smallpox vaccine, but it does have higher prevalence of side effects. So in the United States, it's not recommended. They have a newer vaccine called Jynneos, and that has there's lower amount of vaccine that is available to the population, and the current CDC guidelines recommend that that would be given in 2 doses. Right now, the strategy is to stretch that out, to delay the second dose so that more people who are within high-risk groups can get access to it. But overall, it's still believed that a mass vaccination approach would not necessarily be the right strategy forward. A, because of supplies, but B, there isn't a very high fatality rate. So unlike smallpox, which had 30% fatality rate, within the United States, there have been no deaths, and there have been a limited number of deaths within the African continent. So at this stage, however, we can't say for sure. There's some estimates based on the African data that you could get coverage as good as 85%, but there's still a lot of unknowns in terms of the full effectiveness, because unlike COVID-19, where monkeypox is much more rare compared to the number of infections we saw of COVID, the estimates are based on studies of the immune response within animals. So it's harder to get that real-time data when you have fewer number of people affected. Now, we do see that the spread has been global, and that continues, but it's still nowhere near the spread of COVID, and that makes understanding the numbers a little trickier. And as Dr. Harris has highlighted, we're still also learning about aspects of transmission, et cetera. So surveillance, monitoring, reporting, making sure that public health agencies have all the support and resources they need is critical for these reasons.
Right. Now, Dr. Harris, I want to focus on whether or not the world ignored monkeypox threats. Now, this is something Mark Johnson has written in the Washington Post recently. He says that signs of sexual transmission were largely ignored. In fact, he writes that there were reports from Nigeria in 2017 which basically highlighted that the virus was spreading through sexual contact and mostly affecting young men. And this is exactly what we are seeing right now. So do you think these things were largely ignored up until monkeypox started to hit wealthier nations?
So certainly we haven't ignored it. We have, in fact, been presenting what we call our disease outbreak news, which is our alert information. And if we go back, we have been publishing, advising, informing the world for many years, but increasingly in the last couple of years. And I don't think the world can be blamed for not really noticing something going on during the period we've just gone through, which is the pandemic. So even though we at WHO follow all these things and do all this work, I think the world was very, very, very focused on COVID-19 and actually should still be focused on COVID-19. However, indeed, most countries are not really concerned about something that's happening on the other side of the world. And that's why you need organizations like us to keep on working on those things, because the reality is you're most focused on what's most likely to affect you.
Indeed. Now, Dr. Adalja, there's another element into the report written by Mark Johnson in the Washington Post. He says in 2010, monkeypox cases in the Democratic Republic of the Congo had increased 20-fold from the 1980s to the mid-2000s. Now, wasn't that alarming?
It definitely was alarming, and people in our field started to take attention that this virus was becoming more common, that whatever was causing this virus to spill from the unknown animal reservoir, maybe a rodent, maybe a squirrel, into humans was becoming more common. And I think that was a wake-up call, because we knew that we had vaccines that were stockpiled for smallpox that could work, and that monkeypox was something that could be exported out of those endemic countries, because back in 2003, we had about 36 cases in the Midwest linked to the importation of certain animals, and we had an outbreak. So I do think the longer this was able to spread in the DRC and certainly in Nigeria from 2017 onward, that became more of an alarm. And this could have been something that was dealt with by getting vaccine into the endemic countries. And I think that needs to be part of the solution to monkeypox in the future, not just vaccinating in the non-endemic countries, but vaccinating in the endemic countries so that we can actually stop the actual source of the infection from whatever unknown animal reservoir it is getting into humans. And this, I think, is going to be looked at as a failure to actually recognize or to galvanize the world to deal with monkeypox.
Okay, now there's another concern that I would like you, Dr. Harris, to address. In a recent statement, the World Health Organization said that monkeypox outbreak is not concentrated among gay men in Africa, unlike in other parts of the world. And I mean, in other parts of the world, most of the cases have been reported among gay men. What could possibly explain that?
So certainly the demographics in the African countries reporting are different. It's around a 60-40 split, or 65%, 35% split between males and females. The ages are different as well. However, remember, this is dependent on people coming for care. We may well not be identifying all the people infected. This disease has a very broad spectrum from severe illness, and some people die. In Africa, the fatality rate is around 5%, or it varies depending on the outbreak and the location. So it's a higher percentage of death rate than we're seeing in the global outbreak. So the characteristics are quite different, but it's important to understand that it's happening in many societies where same-sex encounters are not just frowned upon, but illegal, that can put you in jail or worse. So you may well have people who are not very comfortable, or it's unwise for them to identify the contact as having been through a same-sex encounter.
Okay, since we're talking about this, Dr. Harris, what are the guidelines from the World Health Organization for gay men when it comes to monkeypox?
So we say to all people, it's exactly the same thing. It doesn't matter what your particular sexual practices are as such. It's that if you have close contact with someone who's infected, you will be infected. So it's close contact transmission, skin to skin, face to face. Now, if you're having a close conversation with somebody who's got lesions inside the mouth, and the blisters can be inside the mouth, so you may not be aware you have them, or you may not be aware that the person you're having a close conversation with has them. the advice is the same. So it's close contact. It could also be transmitted. It's not clear, but we do see the virus on the clothing, the bedding of people who've got the active rash. So again, if you're caring for someone who's got it, be careful about separating the clothing and protecting yourself while you manage the clothing and the bedding. So the advice is really the same.
Okay. Oksana, now you did talk about vaccines, but I would like you to expand on that. Now, this is something that we mentioned in the introduction. While countries like the US are ramping up efforts to try to secure more vaccines, they have come up with this rather unusual regimen of administering 20% of a usual dose. Number one, is that an effective measure?
Well, there are knowledge gaps around this. I think it's difficult to say now. Certainly, what we do know is that the mass blanket COVID-19 strategy will not be possible or is not advisable in this circumstance. And we need those efficacy studies to materialize rather quickly so that we can make better evidence-informed decisions to help prevent further spread of monkeypox.
Oksana, if I may, so is this a risky policy?
I think it's the smartest policy based on supplies available. There's always going to be some uncertainty and some risk involved in terms of decisions made in times of crisis. But I certainly think based on what we understand about monkeypox at this current time, this is the best way to help protect populations all over the world. But what we do also need to consider is vaccine equity and to ensure that we don't repeat those mistakes around ensuring that vaccine hoarding within high-income countries so that those resources are available in the United States and the UK, et cetera, but not in other regions where there is actually higher fatality rates, as Dr. Harris has already mentioned. So we need to ensure that these supplies are equitably available to all countries. And we did not do that for the COVID-19 pandemic. And we still have not gotten first doses even for the COVID vaccine.
Right. Interesting points there. Now, this is something that we highlighted in the introduction as well, that 1.3 billion people in the African continent do not have access to the vaccine. Dr. Harris, how concerning is this for you as the World Health Organization?
This is always a concern for us. Equity of access to not just vaccines, but treatments, protective equipment is critical. And we have been saying this not just during COVID, but before. We saw this with HIV. We saw that the wealthy countries got hold of the treatments and the poorer countries still had raging epidemics. And it was only when they got the resources that the numbers of people dying began to come down. We also saw this with the last flu pandemic. So this, unfortunately, has been a characteristic of global behavior. But COVID-19 should have told us, you just can't get away with it. COVID-19 is still with us. It's still developing variants because we've still got intense transmission around the world because we still are not vaccinating the most high-risk groups. So let's all learn that lesson and not just learn that lesson, but apply it.
Okay, let me put this to Dr. Adalja. Dr. Adalja, do you think we have learned the lessons from the coronavirus pandemic when it comes to vaccine equity?
I still don't think that it's all sunk in what happened during COVID-19. And it's not just about vaccine distribution. It's also about simple mistakes in the early era of this outbreak. For example, testing being very restrained, vaccinations being hard to access in terms of in the United States being on websites that were crashing, and just a lack of a proactive response to something that had been identified as a threat at least a decade ago. So I don't think that we are quite resilient as a world to infectious disease emergencies. This is something that goes through boom and bust cycles, that goes through panic and neglect. And I really think there is a lot of room for improvement and education of our policymakers to make the world more resilient, because this is something that should be easy to contain. This is a virus that's been known to science since the 1950s, for which we have off-the-shelf antivirals, vaccines, and tests which is not contagious during its incubation period, which is not a respiratory virus, and there's still failure to contain it. So I think that there are a lot of lessons of COVID-19 that remain unlearned. People were aware of all of these things, but again, those same mistakes are being repeated. And I think it's because there are many leaders in the world that do not take infectious disease emergencies seriously, don't fund it sustainably, don't provide resources for it, and then you end up with a crisis that could have been averted if there was more proactive action earlier on.
You know, most of these outbreaks are taken seriously, or at least they appear to be taken more seriously once they start hitting wealthier nations. Is that a frustration that you share as well as the World Health Organization? Because, for example, monkeypox was an endemic in many African nations, right? But we started talking about it once it started to hit wealthier nations, or if I may, the continent of Europe. So tell me, what are your thoughts on this?
So I think the line that is most critical is exactly what my colleague just said: panic and then neglect. And we don't seem to get into the middle. But even with coronavirus, COVID-19, I remember the beginning well. Even when it was arriving in Europe, wealthy countries, we were hearing from countries, oh, let's just let it run through the population and achieve herd immunity, because people didn't care about the groups in society it affected, because it affected older people. In the early days, the science or the epidemiology was indicating that you were much more likely to get severely ill and die if you were 70 or 80. And sadly, we had societies that thought that was fine. So it's even more complicated than saying, I don't care about resource poor countries on the other side of the globe. It seems to be that these decisions are still taken in I'm all right, Jack frame of mind, instead of understanding that with infectious diseases, no one's all right. You have to take them seriously, even if it's on the other side of the world, because it's going to come back and it's going to bite you.
Right. And let me ask you the big question here, which is on a lot of people's mind at this point. With the rise in monkeypox cases, could we be heading towards another pandemic?
So that's exactly why we declared the public health emergency of international concern, to stop that happening. We do believe it is containable, and containable with public health social measures, particularly by working with the populations that are affected. In some ways, we're lucky that it's in the groups it's in Europe and America, because these are really committed, really health literate, really socially responsible groups who are working very hard to communicate within their populations using language and styles of communication that many of us might even be uncomfortable with, to get the message across and to really do everything to contain it. So while vaccines are important, we need to do a lot more work to get the best monkeypox vaccine. What we have at the moment is one that we really need to study and ensure that everybody who has it is in part of a clinical study, so we know much more about whether it is the best way to go. What is critical now is that we all work to take the actions to protect ourselves and others.
Since the beginning of the pandemic, mental health is something that has been largely impacted. Hundreds of thousands of people have been killed by the coronavirus pandemic, and now we are hearing news of this new monkeypox outbreak. So certainly it has taken a huge toll. Believe it or not, it has taken a huge toll on people's mind. So how do we deal with this? If to our audience, if they're watching it right now, what would you tell them?
Well, with COVID, we also see that part of the mental health consequences also link into some of the long COVID experiences. We've seen over 2 million patients report ongoing complications, and that is a big part of it. And certainly the unique experience of has been very different in different parts of the world. So the restrictions vary quite immensely during the early days of the pandemic. And I do think that mental health, unfortunately, has been one of the most under-resourced aspects of health budgets in general, whether that be for COVID or more generally. And what we should be seeing, especially in times of emergency, is that more attention and more resources are available for those particularly who have been impacted and those who are concerned about it. So the main message is to be able to seek care where it is available, and for policymakers to expand that as much as possible so that we can ensure that it's not just the physical health aspect, but also that those that are impacted not only by the disease itself, but all the social consequences around it, have all the tools that they need.
All right. I would just like to correct something I said earlier. Millions of people have died from COVID. It's not hundreds of thousands, and which is indeed a grim milestone. Unfortunately, we are out of time. Dr. Margaret Harris, Oksana Pyzik, and Dr. Amesh Adalja, thanks very much for joining us today here on The Newsmakers. And thank you for watching. You can follow us on Twitter and be sure to subscribe to our YouTube channel. I'm Jafar Hasnan. See you next time.